they're taking their prescription and they're selling or trading it for toxic drugs.
South Surrey MLA Elenore Sturko saying a group of St. Paul's hospital doctors have stopped prescribing an addiction medicine called hydromorphone, in part because it's getting sold and traded on the street for other drugs. But the health authority in charge of St. Paul's is pushing back on Twitter, telling Sturko they haven't stopped prescribing it.
I can confirm that at St. Paul's Hospital, we collectively, as a group of physicians and healthcare providers, are continuing to prescribe safer supply medications. That includes hydromorphone, but also spans a whole host of other medications as a harm reduction strategy.
The honorable member is just joining a pile-on with Pierre Poilievre, with Danielle Smith, people in Alberta, with conservatives and the right all over North America who are now beaten up on harm reduction and beaten up on safe supply.
Clarifying her comments, Sturko acknowledges the hospital still prescribes hydromorphone, but questions how the health authority is giving it to people.
They're still prescribing it. Listen, are they prescribing it for the primary purpose of safe supply? The information I have is that that is starting to be pulled back. City
News reviewed text messages that Sturko says are from healthcare workers who work with St. Paul's Hospital patients and high-level members of regional health authorities. She wouldn't share their names or how many she's spoken to.
That's their primary concern, is about that hydromorphone that has been prescribed to individuals with fentanyl addictions is not what these patients are seeking. They want fentanyl. So these individuals are taking their prescriptions, they are then selling or trading them for the drugs, the street drugs that they want.
Sturko says she's also heard that young people are getting addicted to hydromorphone and moving on to other drugs. But Garth Mullins, the host of the Crackdown podcast, says there's no research saying diversion of prescribed drugs to the street is a big or a new problem.
If someone was diverting it, if somebody was to get a pill they weren't prescribed for, that would actually be safer than if they were scoring just like fentanyl off the street here. So that would provide safety.
In Vancouver, Kier Junos, City News.